Thanks for staying with us here on Journalist Hangout. I've been speaking with Asoko James and Dotun Oladipo about several issues, and then we'll definitely move on with the latest one, which is the COVID-19, which they said may no longer be a global health emergency, but it has not gone away. According to the World Health Organization, COVID-19 is still a major threat, noting that about 10,000 deaths were reported in December 2023. The United Nations agency said data from various sources pointed to an increased transmission in the month, fueled by gatherings over the Christmas holiday. The Director General of WHO, Tedros Ghebreyesus, noted that the virus is still circulating, changing, and killing. Wow. We heard about the Omicron variants, different variants, and even now, recently, we heard about different kind of COVID-19, a kind of flu coming up in China. Well, that is China, but having 10,000 people killed, as a result of contracting COVID-19. How did you receive how does that news come to you?
Well, I was shocked, and even the China you said is just a flight. And then we're in trouble again, like it happened.
They say everything, China. Yeah. I saw a documentary that said, China, anything that flies on air, China eats anything that flies in the air except aeroplane. It eats everything that walks on 4 legs except table. That's so crazy.
No, but of course, they eat virtually everything. They claim it's medicinal, but this figure is high. No matter what we say, whether we consider it as a worldwide figure or whatever, it's high. And it shows that the world is letting the guards down. The simple things that we learned during COVID-19, which we were told in very clear terms that if we continue with, will save us from several other diseases, we have stopped. We have stopped washing our hands regularly. We have stopped coughing with our mouth covered.
Using the elbow.
Or using the, or even if it's
sneezing,
whatever. We have stopped it. And these are little things that we can learn from.
That's right.
Like who told us, World Health Organization told us even during the COVID, large gatherings, everybody must take care. But in Nigeria here, I've been to several weddings. I've not seen that happening. We are just, when you see people go to the dance floor to spray, it's like they're just into themselves. And these are little things that can help us. Let's leave the idea of even the CBN not providing enough naira for us. Even when the naira is available, nothing stops you when you go for a party or you go for a gathering, family gathering, from putting money by transferring to somebody's account instead of deciding. In fact, the kind of naira notes that we have now, I don't know when last you entered into the bank.
They're so dirty now.
When they want to count, I move back.
But you still collect it now?
I don't have a choice when I need to use it. But I mean, even the counting, that comes from the machine. The kind of things it sprays out. It's, for me, when I look at it, it's even dangerous for those bankers. But thank goodness, most of them, they are back to their nose mask. So meaning that at that level, they are taking care. But you see a lot of people just doing things carelessly. What this should call our attention to in Nigeria is we can't be back in the same situation we found ourselves during COVID if we are not careful. I'm not sure if I've had anybody in the last 1 year say I've gone to top up my vaccine. Because those things are still there. They are available at the health centers for free. I'm also guilty. I've not done it in over 6 months, which is the limit, every 6 months. I've not done it.
I've taken the booster jab.
I've been doing it. In fact, I've taken 2 after so I need to go and look at my card now and go back.
That's right.
So we can all be safe.
I'm not sure because after the COVID-19.
You are not even vaccinated.
Me, I'm vaccinated. I also got vaccinated when I got to the UK the last time. I still have the kids if you want, because I got some, that I brought back with me. But the thing is, they said we are in post-pandemic era. But hearing this, and we know the attendant, effect it gave us. People could not, go to office. Now it actually led to working from home, kind of a thing. But Nigerians are gregarious, or let me just use social animal. We want to relate, we want to play, we want to hug, we want to touch. So I don't know, how do you see us, hearing this kind of news that 10,000 people, were taken away by COVID-19?
I think we should be worried, because, and then if you notice that now the economy, global economy, is trying to recover from that last shock of the last COVID, when everywhere was shut down. We're just trying to recover now. I think that is where government across the world is supposed to start thinking and knowing that, guys, we cannot afford to shut down the economy again. Because I can tell you for free,
not even at this time.
Some countries will fold up. If there's anything like that, like companies,
they'll go bankrupt.
It will just go completely down.
Even Nigeria.
Including,
we are just,
most countries are just trying to struggle out of that COVID era, And so, why do we need to go to that era when we know we can easily prevent it? So, first and foremost, go back to how the preventive measures. Go back to sensitization, advocacy in schools, churches, mosques, bus stops, marketplaces, airports, enforce even face mask again, and sanitizers. If you can't even use sanitizers, at least tell people, let's go back to washing our hands. Advocacy really helped the last time, and now it can still help. So we can go back, rather than, because if we don't do this now, Ibrahim, we are going to have that problem. From the statistics I got from NCDC.
NCDC?
Yeah, NCDC. Today, as at today, we have samples tested is about 5.7 million. That is in Nigeria. Confirmed cases, 266,675. Active cases, 3,567. Now, in Lagos used to top, Lagos have about 1,143 people on admission having COVID. Some people will even have COVID. You say, I have a headache, I'm tired, my leg is paining me.
You mean as we speak?
Yes, that's what I'm telling you. This is the latest stats. Data. You understand? So some people will tell you, oh, I have pains on my knees. I'm tired. I'm coughing. I'm cold. I'm this. Headache. Those are symptoms of COVID. It might not just be fever, because everything in Nigeria is when once you have headache, you're tired. Anti-malaria.
It's typhoid.
Malaria
and his brother, typhoid.
You understand? It's anti-malaria. Why not go to the hospital? Let the doctors tell you, okay, fine, these are symptoms of COVID, but you can take this and that. Have you even taken your vaccine? We need to go back to start taking our vaccines.
That's right.
Vaccination is key. Yeah. Why not go back? Some people are bringing the myth of, once you take those vaccinations, it's for 666. Don't be
surprised that some Nigerians do not even, up till now,
I know
we ever had anything.
Ibrahim, so many people didn't even take one. Talk of half.
Because they felt maybe they want to make them.
Of course. So these are serious concerns. If the WHO is now telling you that in Europe and America, they have about 42% of hospitalization, 62% increase in active cases of COVID-19, they are just telling us, giving us warning that these numbers, these 10,000 cases, might increase. Out of these 10,000, they've not added, this is just Europe and America. They've not come to Africa. In Nigeria alone, Lagos has about 1,143 on admission. And we know the impact of COVID-19 back then. when we lost a lot of people during COVID. We were struggling then to, to save people's lives using ventilator, ventilator then. Yeah. So people should, maybe what we'll have to keep doing now is for us to start telling people this is what happened in the past. Save yourself, save others.
And I think that's actually your job.
Yes, of course. That is what we are going to do.
Because I know that one of our correspondents, did a very, very insightful documentary.
Yeah, exactly.
That. So maybe it's time for us to also keep.
We have to bring it back, and so that we show this to Nigerians and say, okay, before people were not able to go out because of this COVID-19. Okay, now. Is coming, is approaching. Yeah. So take these preventive measures. I think that advocacy has to start.
Has to really start again, because Nigerians, we forget things very easily. Daily bread is not something that is easy for anyone to come by this time round. Well,